So there's two different parts of that approach right now. One is if you are immunocompromised. That is a decision that many people may be able to make themselves. If you've had cancer, if you're under chemo treatment, if you've had a transplant, if you're on certain medications, you would be considered immunocompromised. Many people will know that themselves. Some people may need to discuss that with their provider. People that are immunocompromised should
So I'm
seek
using
a
this
third
as my
shot right
bridge
now if
to
they've had the
life
Pfizer or
after
Moderna
this.
vaccine.
So
J&J, we're not sure yet. The data isn't in, so we're discussing that. The larger issue is for everyone that's been fully immunized more than 8 months since their second immunization or their first shot if it was J&J. The recommendation we believe will come out, and we heard it from the White
so
House,
thank you.
is that at that 8-month time period, people should seek another booster shot. Now, remember that, and it seems so long ago when we started doing immunizations, but there was this categorization 1A, 1B. 1A was healthcare workers, long term care, assisted living. So, what we believe we'll see is in that first tranche of people, most of them will be the people that were healthcare workers, long term care, and assisted living. We are waiting for full guidance from the CDC and what we call the ACIP, which is the Committee on Immunization Practice.
And for those people who are against vaccinations, they're already using this recommended booster as a reason not to get vaccinated. They're saying,
Right.
these vaccines don't work because they're already asking us to get a third vaccine. How would you respond to those people?
Well, I think people need to remember that. Remember when you're little, or if you've ever had children, they get multiple vaccines that are the same vaccine repeatedly. The flu shot, we update the flu shot every year. It does not mean that the flu shot last year wasn't effective. It just means that we needed to boost your immune system a little. So there's no indication that the vaccination process that we've done right now, the J&J, Moderna, Pfizer, is ineffective. What we worry about is this sense of decreased immunogenicity, which means your response might not be as great as it would have been the first 3, 4, 5, 6, 7, 8 months after you got your first shot. So we're just giving you additional protection. We're making your shroud less penetrable, less able to for you to get the disease.
And insofar as the booster shots, is the county playing a role? Are you assisting in this
Mhm.
effort?
Yeah, it's a great question. We're in the process of developing our plan to ensure that we can do the boosters. Right now, for immunocompromised people, all of our clinics have extended hours. People may not know this, but we do run three health clinics and they have hours till 7 at night. We've worked with the pharmacies. They're all able to give the boosters right now. I do want to clarify for people that we're not asking you to prove that you're immunocompromised. There is a implicit element of trust, remember, in the patient provider healthcare network and our relationship with you. So we're asking that people that are immunocompromised, either because they know that or their provider has told them that, to seek the third vaccination. As we move into the larger vaccination in September, we will be playing a large role. We actually, like I stated, we're in the process of trying to develop the appropriate response to that. We do believe that we will be continuing to have mobile clinics. We have lots now. We're going to expand those so that we can accommodate the influx of people that need a second shot. On our back of the envelope calculation, we think probably at the highest, we'll have to do about 20,000 vaccines a week. Right now, our pharmacies are doing a great job. They're doing about 3 to 5,000 a week. So what we're going to have to do is all work together to make sure we can escalate that number.
Are there enough vaccines to go around, or are you concerned that there won't be if many, many people turn up saying that they want this booster shot?
We do have enough vaccines. As people have known, we have vaccines in supply. And remember the low temperature freezers, we have lots of vaccines. So what we saw, remember in January and February when people were really struggling and really frustrated because they couldn't get a vaccine, that is not going to be the situation this time.
Any idea on when younger children might be able to get vaccinated? How are those studies coming along?
Those studies are coming along. Remember, what will have to happen is the drug companies who make Pfizer or Moderna vaccines or J&J will have to submit to the FDA. They'll have to go through that emergency use authorization process. There have not been submissions yet to them. We know that the studies are ongoing, and we are aware that some of them are complete. We do expect, or we anticipate and hope that perhaps by the end of September, early October, we'll see the extension of the vaccine into that age group.
We've heard about younger children in other states getting sick, very sick. Is this a concern right here in Pima County and the rest of the state?
Yeah, pediatric cases do seem to be increasing from COVID. We know that there are pediatric admissions. I think what's important to notice within the school system itself, and this number changes by the hour. Since we went back to school, we have had over 800 cases reported to us. We've had a very significant number of outbreaks, which continue to be reported. And we work very closely with the schools. The public health perspective, we have the ability to mandate isolation and quarantine for individual students. We work with the schools to identify who's at risk, who isn't at risk. If there's a recommendation to close a classroom, that recommendation comes from us. And actually, it's more than a recommendation, it's a mandate that certain classrooms be closed if they meet certain infection rates.
Dr. Theresa Cullen from the Pima County Health Department, thank you very much for joining us.
Thank you. Thank you for the opportunity to speak.